How do you collect all the data? How do you look at your A1C sugar levels? How do you look at all the different numbers and then say, am I going off my track? Wearables has thrown a whole new thing into the mix where you're looking at, okay, can my wearable, my Fitbit, my Apple Health Watch, give me insights into if I'm eating right? And some of these things are immediate feedback. I have a tool that's immediate feedback from what I eat. Hey, this is good. This is bad.
Is it one of those things that you put on your arm?
No,
the blood sugar
you breathe
one?
into it. You breathe into it. It's not a sugar
Was that
level.
court ordered?
It actually, as a matter of fact, no. This was a carbon monoxide.
Hi, welcome to the Ursamin
It's the first Ursamin podcast.
That's right. It's Ursamin Unlimited Access. Yeah, I wanted the all-in thing. So it's the Ursamin All-In podcast.
Yeah.
Here at Ursamin, we believe that your health info should be all in one place. We believe patients make better decisions when they have access to all of their records, their data, information. And today we want to talk about chronic illnesses. We also want to talk a little bit about the big conference going on with the JP Morgan. I think it's their 41st annual conference. So let's introduce ourselves. My name is Levi. I am a content creator. I work here at Ursamin with Shannon. Shannon, why don't you introduce yourself?
Hi, Shannon Aylesworth, founder and CEO of Ursamin from upstate New York.
I like to play golf, and Shannon likes horses.
Correct. And dogs and people. And I like golf as well.
That's right. You like golf.
I love golf. I have a lot of hobbies, actually. Yes.
Okay.
Casino. Like to go to the casino every once in a while.
What do you play at the casino?
Oh, I'm a big cheapie. I play the penny slots, man. I'm not risking a lot.
You like to go to the casino so you can play penny slots.
I go with my dad, and it's like we sit there at the slot machines, and I, curse the man in the casino stealing my money. Yeah, it's actually something I do with my dad because he needs to get out of the house. And so we go and we just do penny slots so he doesn't spend too much money because he doesn't have a lot. Mine's going into the company. And yeah, we just do penny slots. We're pretty boring.
That's it. Not bad. Okay. Well, there you go. Well, let's dive into our topics today. Let's talk about patients, chronic care, and chronic treatments, I guess. I don't know if is that the right word? Chronic treatments?
Chronic care. You were right. It's chronic care.
Well, why don't you tell me a little bit more about our mission here at Ursamin and how we want to basically help patients with chronic conditions and diabetes, heart disease, cancer, etc.
Sure. So chronic illnesses are very different from what they used to be in the past. The legacy, I shouldn't say legacy, but historically we didn't have the amount of chronic illnesses we have today where they're just ongoing. They're not acute. You don't immediately end up in the hospital. It's something that kind of sneaks up on you because either the way you ate, diabetes, a great example, what you ate for a while, eventually your sugar gets too high and your body can't handle it. The challenge with chronic illnesses is that they affect multiple organs, multiple systems, and you're constantly having to watch it and maintain it and manage your care on a regular basis. Where in the past it was you could go to the doctor once every 6 months, maybe once a year for a physical, check your numbers, boom, you go live your life for another year and you come back. It doesn't happen like that anymore. There's 67 million people in the country that have 2 or more chronic illnesses, and they interact with each other. So by chronic care, we mean you have multiple system issues. So diabetes might affect your kidneys and your eyesight and your endocrine system. And so you have to manage all 3 or 4 systems to feel good, to have a decent quality of life. So the big initiative, the big push for Ursamin is to support this desire to get a better quality of life by managing your different challenges that you have. And that's where heart disease and all these things. Is it fatal? It's not like you have a stage 4 cancer diagnosis. You may be living with cancer. You may be living with diabetes. And now it's about your quality of life and being able to go enjoy and do the things you want to do. Golf, ride your horses, go to the casino. That's what chronic care is how do you help maintain your highest quality of life?
Things like diabetes, heart disease, cancer, these are chronic illnesses that affect so many Americans? I mean, like, so for example, like
Worldwide.
but specifically, I'm thinking like with Americans and Americans' diet,
Yes.
right?
Yeah.
So we eat a lot of saturated, fried foods, and that affects our heart. We don't exercise. We're overweight as Americans. So this affects a lot of people, right?
Yeah. It's a huge amount. They're expecting, especially diabetes. I actually was doing numbers this morning. It's going to grow 37% in the next 5 years of people. And there's already 170 million people which are diabetic or pre-diabetic. Don't quote me on that number. I think I might be off a little bit because that might be the chronic disease number. But yeah, it's just a significant amount. A lot of them actually significant pre-diabetic. On that front, it's interesting because it's not like it's your fault. And that's where a lot of people, but with diabetes, what's happened is there's so much processed food that the biggest thing that can reverse that is just eating non-processed food. So the saturated fat, actually, I've gone through this diet myself where the fat wasn't the problem. Increased fat and not keto fat, healthy saturated fats, meat fat. I increased my take of red meat, which they ran us off against, and increased my fat and just decreased the amount of processed grains, and my cholesterol went down, even though I was eating higher fats. So there's a lot of functional nutrition out there now that says, okay, there's lots of things that we've just done as a society in our food that is not helpful to our system. So really getting on the healthy track. It's not just, hey, eat better. It is make better choices on the things that you are eating. If you have a choice between something that's got natural sugar versus fake sugar, go with natural sugar, and there's better sugars. There's good sugars out there. So, yeah.
So the chronic illnesses like diabetes, heart disease, cancer affects so many Americans, right?
Yeah.
So many families.
Yeah.
I think you and I know this answer, but let's elaborate.
Yeah.
How does Ursamin help people coordinate? How do we help families actually get access to care and manage this?
Yeah. It's right. It's exactly what we're doing. In order to manage your care, your ability to manage your care is so much different than it was 10 years ago, where you had one doctor to see, they had all your records, you put a plan together and you move on. But what they've seen with chronic illnesses is that you need specialists in those particular direction, right? In those particular specialties, modalities is the word they use. You need specialists. You have to see multiple specialists, and then you have to put that together in a story with your primary care and then make a plan for care long term. You as a patient or a caregiver are trying to figure out all of that data. How do you collect all the data? How do you look at your A1C sugar levels? How do you look at all the different numbers and then say, am I going off my track? Wearables has thrown a whole new thing into the mix where you're looking at, okay, can my wearable, my Fitbit, my Apple Health Watch, give me insights into if I'm eating right? And some of these things are immediate feedback. I have a tool that's immediate feedback from what I eat. Hey, this is good, this is bad.
Is it one of those things that you put on your arm?
No,
the blood sugar
you breathe
one?
into it. You breathe into it. It's not a sugar
level. Was that
level.
court ordered?
It actually, as a matter of fact, no. This was a carbon monoxide. That's another story. No, it actually, like, literally, and it's fascinating. There's, like, I'm starting to look at all these different tools that tell you, like, your blood sugar level immediately you eat, and they're getting smarter and smarter. And so your ability to put all that data together and put it together in one picture is impossible. And if you're doing it for somebody else, you've got to manage your own health, and you've got to manage theirs, and you don't understand their disease process, and you don't understand how they feel. And so you're trying to get educated on that. So what Ursamin does is, hey, let's pull that data together, and then let's match that up with resources and collaboration tools that make it easier for you to work with your family member. My dad, hey, I can see that my dad did XYZ today. He probably needs to do a little bit more walking. I'll go say, Dad, hey, here's a game, walk 10 more steps, or take the dog for a walk. So it gives you the opportunity to hold each other accountable, but also just see what you're doing and how can you every day make a difference on your particular situation.
So we gather all of this data from all of these different sources, and we put it in this one easy to read app that is there. But I think there's two more things that we should really kind of get to. Is number one is we can help you understand it, right? I mean, there's a lot of data. I got some blood work back from my doctor visit, and I don't know. It was like, I saw the report and it
I
made,
think I know sometimes, but that's because I've studied it too much. But no, we don't know.
yeah. So it gave me back this report and I was like, I guess I'm okay. I don't know. I mean,
Yeah.
and I didn't want to see the doctor to get my analysis because I assume he would call me if it was bad.
That's usually, no news is good news.
No news is good news, right? So
Mhm.
there's that. So our app can do that. But I think the second thing about having all this data in one area, it simplifies it for the physician, right? When we
Yeah.
go in to go see the doctor, instead of having a bunch of paper records for them to look over, or it's sporadic, it's all over the place. Instead, what we're actually providing is like one easy, quick snapshot for the physician. So yeah, tell me a little bit more about like how we help our patients actually understand this data.
Yeah, so I think there's two things in there. That was the how do they understand it, and then how do they share that with the provider in a way that's useful. So how do they understand it? So again, you get your records, you get your data, and one of the things I think that's interesting about the wearables, it says this could mean, and if you look at the way that the blood results and everything that comes out of the traditional systems, is it just says here's a swing, it's like a bell curve
Right.
of where you sit, and again, you're fine. But it's not that easy, right? If you have a chronic illness, especially, that usually means something. If you have low magnesium combined with something else, there may be something you can do to feel better, as opposed to call a doctor and say, "Hey, I don't feel good."
Right.
And there's great examples of people going, "I don't feel good." Well, your numbers look fine, and you're like, but they're not. And that's what we've learned about chronic illnesses. It's not always obvious, especially autoimmune diseases. It's not always obvious. So looking at a trend, what's normal for you? What isn't normal for you? What changed? Those are the things that, listen, those are not medical questions, right?
Right.
What the doctor is doing when he asks you that is trying to eliminate what that could be the problem to get to a diagnosis. What you're doing is helping speed that process up. That's what gets you better access is, hey, I haven't changed anything. Here's the way I've been eating. And oh, by the way, yeah, I probably could drink less. And I ate a Big Mac yesterday. And the doctor's probably going to be like, well, that doesn't make you not feel well. But it gives you the chance to not, like, again, lean so hard on the provider to do all of the work for you. You're a little bit of your own detective.
Right.
But that's what our tool will do is give you like, hey, there's lots of articles out there. Listen, we've all Googled and decided we have cancer and we're dying. And it's terrible.
WebMD is everyone was going to die.
Well, right. I used to do it to my mom just to get her so angry. But but you need, like, there's great resources. There's a great like these hospitals that specialize in your particular situation. How do you get access to that data? How do you find it without spending hours? So that's our goal is like, for the diabetics, let's go find the top educational resources. Not, hey, let me help you diagnose, but here's a way to understand your disease, because guess what? You're living with it for the rest of your life. When you're diabetic, you are diabetic for the rest of your life. You can reverse prediabetes. You cannot reverse diabetes. So now you're living it with the rest of your life. And how do you maximize your quality of life? Maybe you want to learn a little bit so it becomes a habit in your life,
Right.
as opposed to an acute, oh my God, I have to do better. And some people, you see, they go through this, teeter-totter of health because they're not doing the right things early on. It's a discipline for diabetes. I don't take that lightly because it's a hard disease. And when somebody tells me they're pre-diabetic, I'm like, oh my God, run away, because it's tough.
Right.
So we want to provide resources that are from the top, not, again, our area is a great area, but we don't have specialists in diabetes. There are so many amazing specialists. Why not learn from them? So what we would do, especially for caregivers as well, if my dad, one of the people on our team, her mom is diabetic, and she's like, I would love to get the resources sent to my app that says, here's the latest and greatest on maybe a particular diet that works really well for this kind of patient.
Right.
Because we're not all the same. So that's what we're envisioning on getting you education. It's not, there's tons of resources out there, but how much time do you have to spend looking for credible sources? The people are looking at the latest and greatest clinical trials. Or I just had a conversation with this doctor last week who said that dolphins actually have diabetes and they turn it off for their feeding schedule. It's insane what people know. Yeah, and it makes it now, again, not everybody's interested in doing that reading. I'm a bit of a nerd. I love the reading, and I, kind of like a math and science girl. So that kind of fact is like, I started reading up on dolphins and their diabetes, and that's how we're learning to get certain drugs.
Right.
That can help diabetics.
So enough about Ursamin here for a second,
Yeah.
because it's all fascinating. And as we continue to progress in the app, and we'll talk about an update on where we're at, this week is the 41st annual JP Morgan Chase Healthcare Conference. And while we're not there, right,
Nope.
in person,
Yeah.
we still want to connect with the people that are there
Yeah.
and kind of connect with the industry. If we were to go through the audience, who do you think is the person that we really want to connect with? Because I think of there's finance people at hospitals, there's doctors, there's nurses, there's insurance, there's payers. There's so many people within the industry. If we could reach out to one, target audience at that conference and let them know who we are, what we're about, who do we reach out to and why?
I think what we want to look at is, is it one person across groups or one group? Because, I've really, in the last few weeks, I've stayed away from talking about payers because I know they already have a big hill to climb,
right,
servicing so many different stakeholders. But the more I dig into it, the more I see that they probably suffer the most from a lack of coordination and enabling the patient, the doctor, and all these other pieces, the caregiver.
Okay.
How do we help you, and how do we be more effective in our mission, which is to help coordinate care better? That's really all we want to do. Is we want to enable the caregiver and the patient to be an active part of that care team. And it's not one of the things that we didn't talk about before on the doctors. Like, the thing I learned a couple weeks ago is not, I knew that they didn't want all data. What doctors want is what's relevant, and your ability to give them and sort through the data. That's one thing I couldn't do when I walked in with my mom and handed this pile of papers to the doctor. And he was like, that doctor, literally, I think he just kicked me out the door. He was like, I'm not going through that.
Right.
Because he'd have to sort through, and there was duplication. And he's like, that's nothing. I was frustrated because I was like, we got to get to the point instead of taking another test. So one of the things that we've built in, and again, not to sell the app because that's not what I want to, but is how do you get them relevant data? They hit a button, the data that they need for diabetes, or the data, because not every data is relevant. Right. So I think, there's that piece. And then going back to the payers, are really the people that I'd love to talk to and say, how do we make sure that we're interjecting in a way where we're not just trying to, there's so many health apps out there. There's so much noise, and there's so many people trying to solve these chronic illnesses. How do we add value, and we come in, what's the best way to go to market for us? What's the best way for us to bring the consumers and the patients and the caregivers to the table? Because that's really our goal, is to, I used to call it ricochet the patient back to the doctor in a useful way. Like I said earlier, going to the doctor prepared. And that provider or the payer is going to probably get the most value because that patient is prepared.
I really don't see a doctor very often. I'm not a caregiver myself. Mm-hmm. Nobody in my family has to go see the doctor very often. So, I feel like I'm fairly ignorant to this day-to-day life of the people that are really struggling with this, right?
You're lucky.
Well, it is lucky to some extent, I guess. But I'm also young. But I did get the senior citizen discount when I went to Dunkin' Donuts.
That's awesome. You're in the, I mean, again, 181 million people have chronic illnesses. You're in the 90 million, right, that don't have it. And you may not ever.
Right. What I was kind of getting at, though, is like, I don't think we understand, we being the healthy side to it, the real challenges of the day-to-day, what it really takes to stay organized. So I have my Apple Watch. Mm-hmm. I go see my doctor, but if and when tragedy does strike, I don't think I'm ready for it, right? And I think having an app like this prepares me. And then the second thing is it will happen maybe with my parents or somebody else in my family at some point in time for sure. Mm-hmm. So it's inevitable that, everybody dies, I guess, right? So we are going to need a way to coordinate this. And I have everything else on my phone.
Yeah.
But I don't have, I have Apple Data Health, but then I've been to two different, there's 3 hospitals here in Syracuse, right? I don't know where my records are for each one of those hospitals. So I guess kind of go back to this conference and who you want to reach out to is like, how can we help? You said there's all these apps. Mm-hmm. As a person not in the industry or from a patient standpoint or a caregiver standpoint.
But you are. You just said your mobile health, your mobile, your Fitbit, your Apple Watch. Here's why I was saying the payers. the payers want you to prevent the future. You don't know what's going to happen a week from now. Okay?
Right.
It is already proven that if you are unprepared at the time that something drastic happens, say you have a heart attack tomorrow,
Right.
you're completely unprepared. So if you were to go on your insurance page, you would see that there's all these, you probably, I don't know, who's your insurance?
I want to say Blue Cross Blue
Cross,
Shield.
okay, maybe Excellus.
I don't know. Yeah.
They have a consumer page where you can get discounts on Fitbit and all this stuff. They're trying to prevent future diseases. And with that, they would say also, hey, here's a way for you to get control of your health so that when something happens, you get better care. So you're right. You as a consumer don't feel the sense of urgency right now because you're like, listen, I'm not prepared, but am I going to buy something? It's like an insurance policy, no pun intended to the payers. But am I going to buy something in case I get sick?
Right.
You don't know. None of us know. And that's why, originally we were like, okay, well, let's talk to the people who have the problem today. That's who we're targeting because there's certainly
chronic,
enough of them.
Yeah.
There's certainly enough of them out there. But the payers look at it holistically as I've got a member base of 4 million, 84% of those have chronic illnesses, and the other 16%, Levi, could have a drastic impact, and his outcome is going to be way better if he has this app or any app, right? Anything that continues to focus on your health, and they can incent you to focus on your health. So that's where the people who are relatively healthy right now, it will be through the payers and the providers who want you to stay healthy, because it's just, if you look at the numbers of people getting sick, it's almost like you can't, it's unavoidable. It's just how drastic is it going to be when you do get sick? And do you want to? And if you don't, again, you have probably 4 or 5 apps on your phone.
I plan on going quickly.
You know what? I'm not going to lie. I was like, at 55, put me down. It's like 5 years from now. I don't know if I'll have Ursamin moving in the direction. We will not be solving, world hunger when it comes to helping connect people to their data. But
you're 50?
Yeah.
All right. I'm 48.
Oh, got you by 2 years. Come on. That's not fair. You said you got a senior citizens discount. That means, man, I'm telling you, 50 did not, it felt old when I was little, but now it's like, as my barn owner said about my old horse, he's got a lot to say. Shannon's got a lot to say still.
And my kids don't listen to it. That's all.
Yeah. Well, I have dogs. They have to.
They have to. Well, let's talk about kind of, again, future updates. So it's January. What's going on within Ursamin? Where are we at? How's beta going? And
we just launched. We're launching, actually. I shouldn't say we just launched. We just got the approval to launch on Sunday. We're launching hopefully today once we get the marketing plan, but it's up. It's on the website. Hop in. We eliminated anything that was difficult because we want people to get in. Well, I shouldn't say completely. Authentication, so verifying that you are who you are, because we are talking about records, is the one piece that's tricky but not hard if you've done it before. Most people have.
Mm-hmm.
I think for older parents, I had my dad do it. It was the lesson learned. So what we're doing in beta is figuring out how consumer friendly is it. So I don't know if you watched the earlier podcasts or the earlier videos, the idea was this was about testing user friendliness,
right?
And this authorization using your license is there's probably a certain age group that it's not user friendly to. So it's already adjusted, just trying to get live. Adjusted how we're going to launch for, especially if you're caregivers of older people.
Mm-hmm.
The caregiver is going to have to go do it. I had to do it for my dad because you just have to. It's not difficult. You scan your license, and then they turn their face, and it's like, oh, it's you. Good. Nah, my dad's fingers were too big. He couldn't figure out how to do anything. So we're officially live. We're going to launch it out. The website, it's live, and we've eliminated everything else like subscription stuff. We just want feedback. What we ask is that everybody finishes a survey when they go through. Get in and out. It should pop up, and it's literally like a minute-long survey that we want people to take and just tell us what you think about the look and feel and navigation.
All right. Well, good. Well, let's wrap, I think. Okay. It's been a good episode. First one.
Yeah, first one.
There you go.
What do we call it? It's a
unlimited access, right?
Oh, no. I was like, no, what do we call this? It's our, what do you call it? Our initial, there's a term for it. It's like anniversaries.
Our birth.
Our birth of Ursamin.
The birth of Ursamin. Well, again, thank you so much, Shannon.
Thank you.
Here at Ursamin, we really believe that people do make better health decisions when they have access to all of their records, their data, all of their information, especially when it's all in one app. So thank you so much for listening. Bye. See you next time.
Thank you.